I'm Robin Murdocco. I'm a physical therapist treating patients on Miami Beach for the past 20 years. We specialize in sports therapy, sports injury, orthopedics, and neurological treatments. I specialize in temporomandibular dysfunction patients, orthopedic patients, neurological patients, and what we strive for is to get people out of pain, into their best function, return back to their lives, and not to rely on us. To rely on their education and knowledge of their bodies to keep themselves in a healthy position. Prior to working with Dr. Nassery, we used to treat a neck patient and with varying degrees of success. Sometimes the patient would get better right away, and sometimes we'd be frustrated and say, why is this not getting better? Understanding the neuromuscular relationship between the bite and the neck has really changed the way we practice. When Dr. Nassery refers a patient to me, he will review the x-rays, the scans, the symptoms, the bite, and I'll have a really good idea of what's wrong with the patient before they come in my door. Then I'm looking for some postural abnormalities and have an idea of how we're going to treat this dysfunction and get the patient out of pain. Patients have had pain for 10 years and they're going to 10 different practitioners to try and get out of the pain without realizing that there's a collaborative effort that can really work. And what I'm seeing from patients is they'll treat it with medication or acupuncture, or they'll go to a dentist. But working together with Dr. Nassery has shown me that the collaborative effort really gets the results that they want, and they get out of pain and they stay out of pain. When a patient walks through our doors where we're looking for postural abnormalities, I'm looking for a head tilt, I'm looking for a forward head posture, I'm looking for a rotation. And all of those things affect the way the jaw sits and affects your bite and it affects your pain and symptoms. What we'll do is we'll get the patient into an optimal spinal position using mobilization. We'll work on the muscles and the soft tissue to make sure everything's the right length and not in spasm. Then we'll do some exercises to stabilize that position, make them stronger so they can hold that position long term. At that point, they're ready to go to Dr. Nassery, and he will stabilize them with an orthotic, and they will stay pain-free, and they're in an optimal position. I've been a physical therapist for 20 years, but the results I'm seeing now make me really happy to come to work because I'm excited about getting people out of pain. And I'm getting the results that I always wanted to get before, but something was missing. And the part that was missing was the dental stabilization. And now that we understand that, the results have been really amazing. Since collaborating with Dr. Nassery and joining the two disciplines, what we see are better results, happier patients, and it makes my day terrific. And I'm really enjoying my work because the results are really fantastic. And it's very rewarding when patients come in after having years of pain and they're coming in smiling and happy, and it's fantastic for us and it's fantastic for Dr. Nassery, and it's working out really well. Working with Dr. Nassery has been truly rewarding. He has a passion for the patients that I have. He wants them to get better, and we work together and we communicate, and it's been terrific.